Good evening, one and all. We welcome you all to the International Webinar Series on Holistic Health, Well-being and Sustainable Development 2022, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence. United Nations Sustainable Development Goals 2015 to 2030 as part of awareness and campaigns in collaboration with Sri Holistic Health Foundation India and Sri Research Institute Center for Arts, Sciences and Wellbeing. Before we start our sessions, let's take the blessings of Almighty.
Kurutvam kalyanam arogyam dhanasampadah Shubham kurutvam kalyanam arogyam dhanasampadah Shatru buddhi vinashaya Deepajyotirnamostute Deepajyotirnamostute Shubham kurutvam kalyanam arogyam dhanasampadah Shubham kurutvam kalyanam arogyam dhanasampadah.
With the blessings of Almighty, we shall continue to today's sessions. Today, December 26th is commemorated as Boxers' Day in many countries associated with the British Empire. It started as a day to give gifts to the household staff of Britain's upper classes, but has been morphed into a sort of shopping holiday of its own. In fact, one of the most popular holiday to return Christmas gifts to the stores back. So now Christmas is over. The celebration continues on Boxing Day on December 26th. The name was first used in 1833, but the exact origin was never been determined. Theories behind Boxing Day include references to Christmas gifts, charity drives, or a nautical tradition. So Boxing Day is celebrated in UK, Australia, New Zealand, and Canada. And it's a holiday even in other countries. The entire British class system worked to make Christmas Day a big deal for wealthy elites. They splurged on Christmas dinners of all sides of meats, geese, turkey, and other fowl cooked by kitchen staff, and household servants worked hard making all the day preparations during the years, well before the conveniences and technological advances of the Industrial Revolution. So messenger boys regularly ran errands and postmen delivered mail and packages year-round. So Boxing Day gave the wealthy a chance to repay their servants and tradespeople with paid time off and small gift boxes filled with trinkets or coins as a show of appreciation for the service during the holidays and throughout the year. Servants and tradespeople also prepared gift boxes for their own families too. Some historians attribute Boxing Day to the small boxes of alms placed near church doors requesting donations to help the poor during the Advent. On the day after Christmas, many of the church clergy would distribute the donations to the needy citizens throughout the community. And it was for this purpose, these charitable acts, because the day was dedicated to Saint Stephen, a patron saint known for good works and his status as a first Christian martyr. Uh, Ironically, during modern times, Boxing Day is synonymous with holiday shopping and good times and sports. We see that many celebrations, commemorations are purely with a business motive to, make a good deal of the day to promote various shopping practices. Basically, there is no historical or cultural context. Most of these Western days, they are just to promote their business and generate some revenue, a purely commercial interest. In the UK, sports are often played on Boxing Day, especially football matches and horse racing. And there is a cricket test match on Boxing Day each year in Australia. There is a cricket match on Boxing Day each year in Australia where they played against another country. And fox hunts were also a big part of Boxing Day traditions. But in 2004, the activity was banned in the UK. Hunters still gather dressed in their finest sports but not follow designated artificial trails. So traditionally, the holiday was celebrated by giving to the needy and less fortunate, but over time, Boxing Day has evolved and been commodified in several different ways. And Boxing Day is also now a time of year when the big sales are offered by shops traditionally after Christmas in the UK, similar to Black Friday in the USA. Sales and revenue are so heavy now in countries that celebrating Boxing Day that now some retailers advertise Boxing Week. These worldwide sales features deals and discounts lasting until the end of the day. Boxing Day is a public holiday, meaning a paid day off in the UK, Canada, South Africa, New Zealand, and Jamaica, and some other countries. And big sales jump off on Boxing Day, also known as Black Friday. Friends and families gather to eat together and to attend sporting events like horse racing and soccer. People also attend the theater for pantomimes like Cinderella or Sleeping Beauty. Boxing Day in Jamaica comes with a Rasta vibe. People party at the beach and attend Caribbean flavored pantomimes, usually performed in Jamaican patios. Jamaicans also go to actual boxing matches on Boxing Day. And today is also Kwanzaa. Kwanzaa, celebrated from December 26th to January 1st, is an African, American, and Pan African 7-day cultural holiday that celebrates family and community. During this feast, music and dance and various activities are organized uh, which are dedicated to reflection and recommitment to the seven principles. The name Kwanzaa comes from the phrase Mutunda ya Kwanzaa, meaning first fruits in Swahili. Swahili is considered as a Pan-African language and also happens to be the most widely spoken language in Africa. Basing the language of the holiday in Swahili represents unity throughout the African and Black communities. The first fruit celebrations are recorded in African history as far back as ancient Egypt and Nubia and appear in ancient and modern times in other classical African civilizations such as Ashantiland and Yoruba land. Kwanzaa developed as a flourishing branch of African American life, and the struggle has recreated and expanded ancient tradition. It draws from various cultures of African people and is celebrated by millions of Africans and African Americans throughout the nation. Each family celebrates Kwanzaa in their own way, but celebrations often include song and dance, African drums, storytelling, poetry readings, and a large traditional meal. On each of the 7 nights, the family gathers and a child lights one of the candles on the kinara. Then one of the principles called Nugzo Saba is discussed. These principles are values of African culture which contribute to the building and reinforcing community among African Americans. The seven principles of Kwanzaa are Umoja, that is unity, Kuchiganglia, that is self-determination, Ujima, that is collective work and responsibility, Ujama, cooperative economics, Nia, purpose, Kumba, creativity, and Imani, that is faith. These are the seven principles of Kwanzaa. Some Kwanzaa traditions include wearing traditional African clothing, letting a child light the candle for each of the 7 days, and decorating home with symbols of Kwanzaa. And Swahili is the language spoken throughout Africa and therefore unites all who celebrate Kwanzaa. One of the most important Swahili words to know are the names of seven principles of Kwanzaa, as already mentioned. So many families celebrate Kwanzaa by playing music and singing cultural African or African American songs. And it's still popular. Over 12.5 million people celebrating it, and 4% of Americans as well celebrate it. And Kwanzaa lasts for 7 days, and since its inception in 1966, it has grown in impact within the African American community and is recognized as an official holiday. Other countries like Canada, Jamaica, and Brazil have gained interest in Kwanzaa but don't celebrate it to the extent as Americans do. So the colors of Kwanzaa are black for people, red for noble blood that unites all of the African ancestry, and green for the rich land of Africa. It promotes unity, and Kwanzaa is considered a cultural holiday rather than a religious celebration, meaning that if you participate in Kwanzaa festivities, you can still celebrate the winter holidays that fall under your religion. And many households will have both a Kinara and a Christmas tree in their living room at the same time. Today is also National Thank You Note Day in US. Is as simple as that. Take time to sit down in your favorite reading nook or at your desk at home and take time to thank of a thoughtful message to tell someone. Text, emails, emojis have the same design and lack of personal touch that is embodied in our unique handwriting. Writing thank you notes provides an opportunity to practice our cursive, which will improve the more notes you write. Whether you are on receiving end or on the writing end, thank you notes are always unique way of giving thanks to someone for something that they have done, whether it was a gift received, an uplifting conversation had, or simply being who they are. Thank you notes make everyone feel loved. And in a time where technology drives our lives, it's nice to put down our computers, grab a pen and paper, write a personalized thank you note, scribbling. Penship acceptable but not encouraged. So with this, we shall end the commemorations for the day. Basically, today we have only Boxing Day, as which is widely mentioned in calendars and are celebrated in West, that is US, and because it's a commercial holiday basically to promote business activity. So huge discounts are given. So we'll move on to the next session for the day. We have with us C. Manasa. She would be talking on role of we have with us C. Manasa. She would be talking on role of pharmacist in dental health. So Manasa, you can unmute yourself, start your video and start your presentation.
Yes, sir.
Yeah, you may continue.
Okay, sir. Sir, is my screen visible? Sir?
Yes, ma'am, continue.
Okay, sir.
It's visible.
Firstly, I thank Dr. Ravindra sir for providing me a wonderful opportunity to talk on the role of pharmacist in dental health and also introducing me. Thank you, sir, for your kind words. And very good evening to one and all. Today, my topic is regarding the role of pharmacist in dental health. Oral health plays a key role in general health and well-being and is important at all stages of life. Oral diseases such as tooth decay, gum diseases, mouth head, neck cancer can be detected with the help of pharmacy community. Coming to the introduction part, it is a rare occasion for dentist or a dental surgeon to consult a pharmacist on a profession basis. As health professionals, pharmacists are key figures in the interdisciplinary health teams that work together, monitoring and caring for people with diseases. In the case of oral health, like their proximity and accessibility often make them first professional to whom many patients turn when they need to clarify certain doubts about bleeding gums, sensitivity to heat and cold, dry mouth, and also with the prescriptions and how to use the medications and the timings of the medications has been cleared by a pharmacist. Many people walk into the pharmacist with gum complaints. They may leave the pharmacist to suspect bleeding gums, bad breath, extreme tooth sensitivity, tooth mobility changes, and tooth position. Here, the pharmacist plays an essential role to improve the early diagnosis and prevention of gum diseases, as well as to collaborate with the dentist in monitoring its evolution. But the mutual relationship between the pharmacy and dentistry work and only exist if both the professions understand each other expertise. Let us see what exactly the scope of a pharmacist. Pharmacists have traditionally been regarded as drug compounders and dispensers. Technically, in addition to compounding and dispensing, pharmacists are entrusted with participation in drug selection and utilization, the proper and safe storage of drugs and medical devices, and maintenance of proper records, and also giving drug information as regards therapeutic use, values and hazards, and patient counseling on use and misuse of drugs. Actually, they take a preliminary role in after getting the prescription. Many of the patients or the respective subjects, they have no clue how to use the medicine, at what time they're supposed to use, and before the lunch or after the lunch, what kind of food they're supposed to eat. So all these preliminary concepts has been covered by the pharmacist as prescribed by the physician prescription. So tooth decay and oral hygiene. Tooth decay, it is the most widespread non-communicable diseases according to the World Health Organization and can be traumatic for both child and adult. It may result in pain, lead to infection, and result in hospitalization and extraction of teeth under general anesthetic. Good oral health is also essential for healthy aging. A healthy mouth will also improve general well-being and quality of life. Tooth loss and fitting dentures in older people affects their ability to eat, speak, or socialize properly. We may see in TVs and all, most of the advertisements, many of the people, they have some problem in their orientation of teeth and all. So they may feel very uncomfortable while they are eating, speaking, and gathering social gatherings. So it also put them at higher risk for malnutrition, sometimes cardiovascular diseases, and infectious respiratory diseases such as pneumonia. So nowadays we are actually keep on dumping adulterated food like chocolate, biscuits, ice creams. See how the germs are literally fighting on this dent, teeth and all, how they are suffering. We thought of eating chocolate, this, that. So poor oral hygiene and frequent consumption of sugary foods, drinks, cakes, biscuits, chocolate, sweets, fizzy drinks are the main causes of tooth decay. Acidic foods and drinks like fruit juice and smoothies can also cause dental erosion. Tooth decay is largely preventable, and the pharmacist can play a major role in reinforcing messages about healthy eating and good oral hygiene, and also giving general advices for both children and adults. This is how it start decaying. The healthy tooth will start decaying, carries, and it carries to the cavity and start spreading pain. When a baby is born, the first set of teeth is already under the gums. So, a clean, damp cloth should be used to wipe the gums after a feed. As soon as the first tooth appears, brush twice a day, at night time and on other time, with the soft toothbrush and water. Do not use toothpaste for under 2 years unless advised by a dentist. Making healthy food choices by eating more fruit and veggies and avoid sugary snacks and drinks in between meals. Unflavored milk and water are the best drinks. Read food labels for sugar content. Those who are diabetic, less than 5 gram per 100 grams is considered as low sugar. Gum diseases is caused by a buildup of plaque on the teeth and around the gums, causing red swollen gums which bleed when brushing. If left untreated, the gum diseases will progress to periodontal disease, which causes bad breath, receding gums, wobbly teeth, and ultimately loss of teeth. Smoking, it also increases the risk of periodontal diseases. Smokers are likely to get periodontal diseases and prematurely lose their teeth than non-smokers. Poorly controlled diabetes increases the risk of periodontal disease development, which in turn can make it more difficult to control diabetes. People with diabetes should be encouraged to have a good oral hygiene route and regular visits to their dentist. It's not like regular visits, like once in a 3 months or once in a 6 months, you have to surely go and check. Mouth, head, and neck cancer. Over 700 cases of mouth, head, and neck cancer are diagnosed every year, especially in UK and also in Ireland. Smoking and drinking alcohol are the most important risk factors. Alcohol plays a role in up to half of all cancers of the mouth. Medication. We couldn't say this is a kind of medication, but some preliminary points, like some liquid medicines have a high sugar content, so that dentists will recommend to switch for sugar-free alternatives if they are available, especially where medicines are given frequently or long-term. Dry mouth, it is also a side effect of some medication. This is particularly uncomfortable and often gives rise to difficulty in speaking and eating and impacts negatively on quality of life. Furthermore, reduced to saliva flow can give rise to an increased incidence of gum disease, tooth decay, and also an increase in oral infection. Stress. Nowadays, due to this pandemic situation, this COVID and all, so it is really stressful and is impacting on mental health and people in different ways, including their eating and snacking habits. So we completely surrounded by eating adulterated food. Sometimes due to emotional stress, it is possible to smoke more in times of stress or worrying, impacting negatively on oral health. And also the heavy use of alcohol increases the risk of acute respiratory distress syndrome. Recently, the World Health Organization also states that smoking impairs lung function and making it harder for the body to fight off coronavirus and other respiratory diseases. Sport. As all we know, whenever we go to this sports and all, sometimes injuries to the teeth arise from accidents during normal everyday activities such as playing contact sports. We recommend to always wear a mouth guard as a great preventive measure. Tongue cancer. It's a type of head and neck cancer. When the cancer is in when abnormal cells start to divide and grow in an uncontrolled way. Symptoms can include a spot or a lump on your tongue that doesn't go away. Actually, it stays like that. The main risk factors are smoking, drinking a lot of alcohol, and infection with the human papilloma virus, HPV. The tongue, there are two types of to your tongue, the oral tongue. The base of the tongue, cancer can develop in either part. The oral tongue is the part you see when you poke of your tongue out at someone. This is front 2/3 of your tongue. Cancer that develop in this part of the tongue come under a group of cancers called mouth or oral cancer. This is how it will be. The upper layer is nothing but lip, and inside the oral cavity, we near to the pharynx, we have this vulva and the tongue. We can see here the tongue, and the back side of the tongue is nothing but frenulum, and down to that, near the jawline, we have this salivary glands. So this diagram has been showing the parts of the mouth above and below the tongue. Now, the base of the tongue is the back third of the tongue. This part is very near to your throat called pharynx. Cancers that develop in this part are called oropharyngeal cancers. We can see here in this diagram, here it is located, the soft palate, and next to that we have back wall of the throat. Down to that, the tonsils area will start. Before to that, a pink color line is nothing but back 1/3 of the tongue. There actually this cancer cell will start growing. So the types of tongue cancer, the most common type of tongue cancer is squamous cells carcinoma. Squamous cells are the flat skin cells that cover the lining of the mouth, nose, larynx, thyroid, and throat. Squamous cells carcinoma is the name for a cancer that starts in these cells. We'll see what are the symptoms of this tongue cancer. A red or white patch on the tongue that won't go away, a sore throat that doesn't go away, a sore spot, ulcer or lump on the tongue that doesn't go away, pain when swallowing, will get a loads of pain, and numbness in the mouth that won't go away, pain or burning feeling over the tongue. Problems moving your tongue or speaking. When we are talking with someone, we can personally get to know that we are suffering. A lump in the neck, an unexplained bleeding from the tongue that's not caused by biting your tongue or other injury. Point to be noted. And pain in the air. This is very rare case. It's important to remember that these symptoms might be due to a less serious medical condition, but it's best to check symptoms with your GP just to make sure. And what are the risks and causes of tongue cancer? Smoking tobacco, cigarettes, cigars, and pipes, regularly drinking a lot of alcohol, infection with a virus called human papilloma virus, HPV. We are getting many kinds of varieties in this smoking and all. Whenever we see outside now, they'll get lots of varieties. They never ever take care of their mental health. They keep on smoking 24/7. So kindly don't do that. It may affect other person also. Indirectly, they are also breathing it. HPV is a type of virus that infects the skin and cells lining the inside of the body. For most people, the infection will get better on its own and they will never know they had it. After going through many years, they'll get to know in the advanced stage something they have got. This is a common virus that causes no harm in most people. It may sleep silently and some other day it trigger out. But in some people, the virus can cause changes in the mouth and tongue that can increase the risk of the cancer in that area. So the stage of your cancer depends on, we couldn't say this is first, it's already done. but how far your cancer has grown into local tissues, whether it has spread to nearby lymph glands or whether it has spread to any other part of the body. So tongue cancer that starts in the front 2/3 of your tongue is staged as mouth cancer. So this is how it will be inside the mouth. The conclusion. Improving the pharmacist training. Actually, the role of pharmacists in dental health, if we improve this kind of corner with interaction with the dentists, since there has been major progress relating to our knowledge about oral health, and there are more and more health products on the market, pharmacy professionals need constant training and dentists must help them with that. Pharmacists and dentists form a team to secure the best oral health for everyone. Pharmacists should receive a specific up-to-date training from dentists, and likewise dentists should assist the pharmacist back by recommending that they dispense products whose efficiency has been scientifically proven, while explaining the difference between the diverse products on the market to their customers. And these are my references. Once again, I thank Dr. Ravindra sir for giving me this wonderful opportunity to participate. Thank you, sir.
Thank you, ma'am. It was a nice presentation with insights into pharmacist's role in dental health. And we wish you all the success and look forward for more sessions in the future.
Thank you, sir.
So we will move on to our next session by Mary Florence on role of social worker in dental health. So before we start the next session, quickly, everyone fill up the feedback form. We have 5 minutes for the feedback form for session 1. Then we'll move on to our next session. Feedback has been raised in the form of polls in Zoom. Do not close it unless and until you fill it and submit it. It is mandatory to fill the feedback form. It is through this we get the details for preparation of certificates. So everyone quickly attend to the feedback form. And all details are mandatory. So quickly fill all the details. Okay, then we will be having a session by Mary tomorrow. So let's look at the multidisciplinary approach or team in dentistry and dental health. As today's dental practices, we have seen there are importantly 9 specialties in dentistry as know, shared by our dental experts yesterday, day before yesterday in a national seminar and as well as international workshop. So it is becoming more difficult to manage the challenges of closing the gap between science research, that is best practices, and the optimum patient care. Many patients still see dentistry as an elective service and not the preventive medicine as it is. So with that in mind, patients could also present with medical problems that could delay, prolong, or even rule out dental treatments they want or need due to other priorities in their medical health. So this is unlike a medical case synopsis, which makes it easy for the doctors to execute a prescribed path of care based on best practices, such as kidney disease or other diseases which immediately require some form of dialysis without any negotiation from the patient. And dentistry has always and will allow for a unique approach and conversation with each patient in their decision making process for their desired outcome. So, in dentistry, a risk assessment is determined at an initial appointment when gathering information and all of the diagnostics needed to create a case synopsis for optimum outcomes for the patient. As these recommendations for preventive, functional, and aesthetic goals are discussed in depth with the patient and the dentist prioritize treatments based on the most realistic outcomes. Patients desire the best available care provided by a qualified, multidisciplinary team of professionals and specialists who are part of their general dentist collaborative circle in order to realize for the most economical investment and greatest value. So, success in being efficient and obtaining optimum results for the patient can only be achieved with a team that is committed, coordinated, possess clear communication skills, and cares. So, delivering safe, lasting treatments must be paramount while still maintaining a well trained internal support team with an ecosystem that will withstand any type of patient needs, maintaining a focus of closing the gap between scientific research and patient care delivery and sustaining practice profitability. And to move towards mastering an ecosystem in the culture of any practice, systems and strategies must be created and maintained with each procedure provided to the patient without exception. Supporting technology is the catalyst for an efficient ecosystem in the culture of each practice. This includes, but is not limited to, all diagnostic technology, practice management software, data processing and documentation, and a system for all providers on multidisciplinary care team to virtually review and discuss the case synopsis and their part in the care delivery. It also includes a shared portal or responsibility through which the internal support team ecosystem can communicate and track patient progress throughout the entire patient experience of preparation and post care. So, this allows a more efficient transfer of information and care, and as a result, more patients will be satisfied and feel that not only they made right decision, but they are apt to refer others who desire the same outcome level that they have obtained. So a practice structure that has shown promising results is that of multidisciplinary care team committed to excellence through best practice scenarios. The multidisciplinary care teams should be formed and function with a zero tolerance attitude for mediocrity that surrounds and drive them to achieve consistent execution. The right place, people, process, and technology are integrated and utilized efficiently and effectively. Efficiency in the practice will be important in the future as a result of society shifting focus towards prolonged health and the realization that the oral health is a significant factor in overall health. Once this preventive mindset is instilled in patients, they will demand practices that offer a consistently effective, streamlined standard of care with accurate diagnosis, record keeping, and patient information that can be quickly and easily shared among everyone involved in their treatment. So, an efficient internal support team has commitment to the process and will work diligently to reinforce the new paradigm that through repeated opportunities as more patients are processed with a focus of closing gap between scientific research and patient care delivery. They will also consistently demonstrate a zero tolerance in every step to ensure continuity of use of all supporting technology that will enhance the quality of their dentistry. This is usually the measures adopted by every practice profitability margin. The internal support team's motive to set up mastering efficiency in functioning each day will be equal to their individual desire for purpose and anatomy and autonomy in their job. Many will undergo creative training and development, particular to working in this type of practices, and they understand that effective and efficient communication is core of being part of excellent multidisciplinary care team. The ability to record, save, and instantly share information with all involved team members provokes the ability for everyone to collaborate. This facilitates the best practice approach to care based on screening, prevention, education, behavior modification, routine care, serious care, chronic illness pain management, or restorative care. This means that the patients can be treated as efficiently as possible, which in some cases may be important to their immediate health. To become an efficient, there are basic steps a practice can complete. First, be sure to have a large capacity people as your internal support team able to understand and function in a multidisciplinary setting. Secondly, an ecosystem for all the process from hello to goodbye is necessary. Establishing in-service training and education to make sure practice management software and all other charting notes and documentation protocols penetrate the soul of the practice for excellent risk management and maximized outcome in communication with all specialties on the care team. Then assess what the patient experience is like in your practice from their perspective. So ask yourself if you are providing a thorough risk assessment of each patient's case, a comprehensive evaluation, case synopsis, and treatment strategy. Always engage the patient in decisions about their dentistry and health based on a clear vision of why they want and what they want. The practice culture dictates what experiences the patient will have and how the patient interrupts those experiences throughout their care sequence. The key to efficiency in this aspect is making certain that the patient is heard, engaged, encouraged, comfortable, and the planned care sequence will provide the outcome that shouts an extraordinary experience. This will increase the relationship equity built within the patient, thereby increasing value proposition and increase referrals based on the felt. So lastly, the impetus behind the efficiency mindset, the supporting technology must be fully utilized within a multidisciplinary care setting. This is because at times a multidisciplinary care team member may be at a remote location. Utilizing a mobile device puts them in the same room with the patient or other team members. We already know that dentists alone cannot always solve some or more of complex problems, oral, cranial, and facial problems with which patients suffer. So this is when the dentist will traditionally refer his or her patient to a specialist in order to seek additional expertise. In a particularly complex case, there may be several referrals to several different specialties over the course of treatment. The multidisciplinary approach to treatment can be very effective as one specialist cannot deal with all aspects of a complicated problem. However, it can be a bit one sided since information travels between the dentist and the specialist without any time or place dedicated to collaboration. The interdisciplinary approach brings in that missing collaborative element and allows all specialists involved to conduct a dialogue concerning patient care. Interdisciplinary dentistry focus on interaction not only between the primary dentist and the specialist, but also between the interdisciplinary team and the patient. The patient should always be included in the process as a member of the team and should be updated regularly on incoming information and decisions, including the patient in the way not only brings the treatment to a new level, but it also provides optimal customer service from the dental practice. The interdisciplinary team creates a network of shared skills and expertise, open communication, and trust. The ultimate goal is to create and perpetuate an ideal treatment environment in which patient feels comfortable and doctors can work efficiently. And as we know, all the medical professionals are allied with medical health professionals and paramedical professionals. You take anyone in the medical setup or healthcare, they wear many hats within his or her practice, like business owner, boss, clinician, customer service provider, manager, leader, or a care provider. With these responsibilities already in place, it is easy to view interdisciplinary dentistry as extra work that could be handled just as well with the simple reference. So even though establishing the interdisciplinary team may require an extra time investment upfront, once the team is in place, it provides a much more effective framework for treatment. It also opens the lines of communication, reducing stress and confusion for all the members of the team, including the patient. Clear expectations of the intended treatment outcome are built into the interdisciplinary team's framework. As a result, and by its very nature, the team approach allows for some more efficiency and a better treatment outcome. The initial formation of the ideal interdisciplinary team can require a considerable amount of time and energy. However, it will be worthwhile to your practice to create that valuable network of specialists on whom both the dentist and the patient can rely. Team members should meet at the beginning to discuss the patient's diagnosis and treatment plan together by combining the individual skills and expertise of all the specialists. A comprehensive treatment plan can be developed. As within any sort of collaborative effort, the interdisciplinary team can benefit from a written agreement delineating all responsibilities, expectations, and financial compensation. The team should discuss every aspect of the treatment plan in detail and ensure that the plan is customized to the patient needs. Then, at every step of the process, all members of the team will follow the treatment plan. It is important to remember that the patient is an essential part of the team and should be included in the development and execution of treatment plan. Once an atmosphere of open communication has been established, it is much easier to avoid mistakes and confusion during the treatment process. The key is to start the interdisciplinary process before the problems arise and not after. Rather than making referrals and subsequently engaging in dialogue with specialists, should a problem arise, be sure to collaborate actively with other members of the team at the onset of treatment. Be sure that all members of the team are working together on all steps of treatment plan. The beauty of collaborative work is that everyone can give each other advice and build on each other's ideas. Rather than passing down orders, team members can ask for input and suggestions. Again, be sure to engage patient in the dialogue. Instead of commanding your patient to do something, ask the patient if he or she would be comfortable with a given method of treatment. Do not hesitate to consult other members of the team if a problem arises. Overlooking something or misdiagnosing a patient can lead to lack of treatment or unnecessary multiple treatments, which can be ineffective at best and harmful at worst. So there might be different disciplines within the dentistry, like dental hygienist, dental nurse, dental technician, dental technologist, dental therapist, and finally dentist with many specialties or super specialties. And the multidisciplinary approach is gradually spreading to a broader number of dental specialties, and collaboration in orthodontic treatment, prosthetic rehabilitation, either with implants or tooth-supported prostheses, is becoming more common. They usually require the work of several disciplines at once. In general, the greater or lesser complexity of the treatment will lead to the participation of a greater or lesser number of specialties. Let's look at the few of these specialties. If we take, for example, in UK, we have around 1,06,313 dental professionals. Those who have registered with the General Dental Council in UK. These statistics may be little older and may not be to the date. Of these dental professionals, 79% of the dentists are male, whereas 76% of the dental professionals are female. and a staggering 98% of dental nurses are women. In terms of number of patients available for healthcare fieldwork, statistics show that 7.77% of people visit a dentist on a regular basis for routine checkups, with 67% going at least once in every 6 months. And of those who visit a dentist regularly, 74% do so as NHS patients, while other over a quarter, 28% visit private dentists. Although the role of general dentist is mainly preventive, there are a number of specialists or specialties and specialists in the dentistry team who work together to improve dental function and appearance. The multidisciplinary team includes, but not limited to, general dentist concerned with care and maintenance of teeth. General dentist place an emphasis on preventive care, including biannual checkups and dental cleaning, as well as restorative treatments. Cosmetic dentists refers to dental work that improves the appearance of a person's teeth rather than the function. Cosmetic dentists work in private clinics and offer treatments including veneers, teeth whitening, and implants. Endodontists are concerned with the internal working of the teeth, including the pulp, roots, and surrounding tissues. They focus on the causes, diagnosis, prevention, and treatment of diseases, as well as injuries to the nerve of the tooth. Orthodontists specialize in treating patients with incorrect positioning of the teeth, also known as malocclusion, resulting in an improper bite. They use a variety of devices such as braces to reposition misaligned teeth. Prosthodontists are highly skilled professionals specializing in the restoration and replacement of teeth to improve appearance and function, and have expertise in both simple and complex restoration. Periodontists specialize in the prevention, diagnosis, and treatment of periodontal disease, an advanced form of gum disease that can lead to tooth loss if left untreated. Oral and maxillofacial surgeons, OMS specialists, treat diseases, injuries, and defects in hand, neck, face, jaw, and hard and soft tissues of the oral maxillofacial region. Linking dentistry and medicine, they help patients suffering from problems ranging from cleft palate to oral cancer. Pediatric dentist, within 3 years of additional training, pediatric dentists treat children only and are the primary oral care providers for infants and children throughout adolescence, including those with special health needs. Dental nurses assist dentists with all aspects of patient care, from simple checkups to specialist treatment. They work closely with the dentist to ensure that the right equipment is available and there is effective infection control, as well as recording information about oral health. Dental hygienists specialize in the promotion of clean conditions for the preservation of health, providing clinical and education care to help patients maintain oral health and prevent gum disease, as well as developing home treatment plans. 93% of the hygienists in the UK are female, an important factor to consider if you are including quota splits in your medical field framework. So with this, we shall conclude today's sessions and quickly fill up the overall feedback form. Feedback form has been raised in the form of polls in Zoom platform. It's mandatory to fill the feedback form. Quickly fill up the feedback form before leaving the platform. We thank everyone for joining us. See you all tomorrow at 6 o'clock. Take care. Good night.